Hi, good morning, Peter. My name is Mihiraa. I'm your invigilator for the OIT speaking session on the 27th of February 2022. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My name is Peter Campbell.
And what is your candidate number, please?
My candidate number is 230024644.
Thank you. And you are taking this test as a nurse, is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed, and it is a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right, Mihiraa.
Tell us about your growth as a nurse.
Spending the past 5 years in the nursing field, working directly with patients has shown me just how far active listening can go in making a patient feel comfortable. In my previous role, I was lucky to be mentored by the sister on the ward. She taught me how essential it is to apply the same communication skills with senior doctors too.
How do you remain current in your medical training?
To remain up to date in my field, I attend yearly conferences, and I maintain subscriptions to receive news about updates in the field and information about clinical issues. I make sure to follow the latest studies that affect healthcare as well.
What makes you a good nurse?
Being teachable makes me a good nurse. When I interact with patients, I learn to be more patient and understanding every day. During breaks, I find it so fascinating to learn about new innovations in nursing from my more experienced colleagues. My openness to experience has always given me an edge in patient care.
How would you deal with a rude doctor?
I have been very lucky in that I have had the good fortune to work with doctors who were always professional in their interactions with me. If I were to work with a doctor who treats me badly, I would bring the matter to my supervisor right away. That's because if the doctor was displeased with me in some way, I would want to find out so that I could take action to rectify the situation.
Describe how you provide quality care for patients.
My work as a nurse is to provide quality care to my patients at all times without fail. When starting my shift, I arrive 1 hour beforehand to create a schedule for my patients and complete any other extra activities I have during my shifts. To be sure, I have my notebook with me at all times to cross-check my activities. This method allows me to provide quality care to my patients.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihiraa.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start the roleplay, which will last for about 5 minutes. Don't worry if I stop you when the time is up.
Good morning. I am Peter Campbell, one of the nurses on duty today. How may I address you?
Good morning, nurse. My name is Mihiraa.
Hi Mihiraa, may I know what brings you here today?
Nurse, I am a bit worried about my situation. For the past 5 days, I have developed fever, chills, and body aches.
I am sorry to hear that. Well, Mihiraa, can I ask you a few questions for better understanding?
Sure, you may please.
Thank you. May I know about your symptoms in detail, please?
Okay. In the beginning, I have been experiencing a cough, runny nose, and sore throat. Later on, I developed a fever, chills, and muscle aches. Therefore, I tried some remedies. Unfortunately, this morning, I also started with nausea, vomiting, as well as breathing difficulty.
Oh, is it? Mihiraa, I would like to know, did you have any sort of contact with any similarly ill patients?
No, nurse.
May I know about your recent travel history?
By the way, nurse, I have recently traveled to attend a marriage ceremony.
All right, thank you for your information. After listening to your symptoms and recent travel history, there are chances for you to have COVID-19. But, for confirmation, we need to do some investigations.
May I know, what are the investigations you suggest?
For a better identification of the cause of your illness, we must go for a nasal swab and a throat swab test. It is a small procedure that will only take a few minutes. It is to identify the type of virus or bacteria present in your body.
All right. But nurse, I have already taken 2 doses of COVID-19 vaccinations. Still, will it be COVID-19?
Mihiraa, your concern is quite natural. I can explain it in detail about it. COVID-19 is caused by coronavirus. The point to be noticed is that the virus strain constantly changes due to evolution. This is why it is contracting again, even if you are vaccinated. I hope it is clear to you.
Yes, I got it.
Perfect. Additionally, a blood test needs to be done to check if you have immunity to the COVID-19 virus by looking for a specific antibody in the bloodstream. Antibodies are small proteins that are part of our immune system.
Okay. That's fine.
And finally, if you tested positive for COVID-19, a chest X-ray is needed. The X-ray is to identify the spread of infection to the lungs.
Yes, it's clear.
All right, after analyzing your symptoms, you will be consulted by the doctor and provide definitive treatment.
What are the treatments that I can expect?
Mihiraa, in this situation, you can expect hospitalization. Because your breathlessness can only be treated with oxygen administration, and for your persisting symptoms, a set of IV antibiotics is inevitable. Moreover, continuous monitoring of your condition is also essential in this situation.
All right. I understand that.
That's great. Mihiraa, I wish to inform you that, as you wait to see the doctor, kindly wear an N95 mask. That can help to prevent the spread of the illness.
Of course. I understand the importance.
Thank you for your understanding. Is there anything else I need to clarify?
No, not really.
Thank you, Mihiraa. Kindly wait for the consultation. I wish you a speedy recovery.
You are welcome. That is the end of your OIT speaking roleplay. All the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.